Honestly, she was like a grandmother to me. She was kind and generous and loving, very compassionate about assuring that her community, because that's what she considered Society Hill was her community, got the best of everything, and especially around in health care. But she could also be a pretty firm disciplinarian, and she was not going to compromise on things that were important. In those very early days, there was a lot of unknown. This was during a period of time where they weren't even called community health centers then. They were called rural health initiatives, weren't as firmly considered in the whole healthcare panorama. As a matter of fact, in those early days, our continued existence was very shaky. It depended a lot on things that now are not of a consideration. We had to have enormous support from the medical community, for example. And remember, I'm talking about 1980. And sometimes the medical communities aren't always open-armed when there is a federal project coming in. And in those days also, we were a majority-supported federal program. So it was tough, but she not only was someone that was undaunted by barriers, but she was also an organizer and a great community supporter. So whenever we needed community support, man, she could pull it together. It was amazing. I can honestly say, specifically, I'm here because of Miss Gerald. When I took this job, I had been in California. I was born and raised in this area. I was born in Dillon, but back in those days, it was the bigger areas were more attractive, and I went to California to get experience. I left California having been an administrator at a 208-bed subacute facility. In other words, I thought I was pretty hot stuff coming back home. I'd had the California experience, and it wasn't, remember it was the late 70s, early 80s, and South Carolina, and young women weren't exactly welcomed with open arms in healthcare administration. So my grandmother was part of a rural health initiative over in Atlanta, and they were looking for someone to help them get started, but they wanted that person to move to Atlanta. I didn't want to move to Atlanta. My husband was working in Florence. But then my grandmother told me about where there's something going on in this community up there in Society Hill. And I checked it out. Miss Gerald was part of the recruiting. And the way she could describe things, and you could see it coming out of her eyes. Her heart was so open and generous. I still thought to myself, okay, I was offered the job. I said, but I don't need to necessarily be here for the rest of my life. There'll be bigger and better things. But every time you met with her, every time she told you about a new need, your heart just knew that was where it was. Because of her, I'm still here. I think in a way she would be disappointed, to be honest. I think that she would think that after this long a period of time, wouldn't there have been improvement? Our counties are still, the counties in the PD are still in the bottom of the Robert Wood Johnson and other measurement ranking entities. Now, CareSouth itself does very good, but we only serve a little bit less than 40,000 people. And there's a lot more than that in these whole 5 counties. I think she'd be disappointed. I really do. I don't know that she would be disappointed in us in CareSouth Carolina. I think she'd be very proud of that. But I think the disappointment would be in that she would look around the communities And we still have some of the same problems we had back in the 80s. I think that she would, though, very strongly be someone who would be a force to be reckoned with whenever opportunities came around, and opportunities that not everybody takes advantage of. I mean, she could make you feel like, why aren't you going over to that clinic? You need to be seen by that doctor. Why didn't you go there last year? She would be that straightforward. She was a force to be reckoned with. I hope that they remember that we're all here because of her, just simply put. I know that there was a large community board, and there was. The roots of who we are now began in Society Hill. But, back in the 80s, strong-willed women and leaders in the area and minorities, they had to work in different ways. Although sometimes I look back now and think, I don't know that things have changed in 40 some odd years all that much. But she made it almost seem, I don't want to say effortless, because I could always see the effort that she put into it, understanding that the needs, and there are and were then significant needs. I think that would be her legacy, that she would be able to look back and say, well, we did it. We made an organization that changes lives. And she would be proud, I think.